live by one simple rule. If it spikes my insulin, I try to eat it as least often as possible, and that's it.
This is On Nutrition, a podcast from Mayo Clinic, where we dig into the latest nutrition trends and research to help you understand what's health and what's hype. I'm Tara Schmidt, a registered dietitian with Mayo Clinic in Rochester, Minnesota. This episode, insulin resistance. You might have heard about it online. It's when your body doesn't accept sugar into your cells for energy, resulting in weight gain, fatigue, and other health issues down the line. Almost half of adults worldwide are insulin resistant for various reasons. And while it's an emerging field of research, there's a lot of interest in what this means for our bodies and our health. Our guest today has dealt with insulin resistance personally and is working to expand the research about this condition and help people online find solutions. Dr. Ali Chappell is a registered dietitian and the founder of Ensara, a digital health company helping patients improve their insulin levels. Hi, Ali. Thanks for coming on the podcast today. We're super appreciative of your time.
Thank you for inviting me. Very excited to be here.
Let's get going. In order to understand insulin resistance for our audience, can you please explain what insulin does and why it's important to our body?
So I like to use this analogy of like an iceberg. What people think of insulin is what's above the iceberg. They think it's a hormone that lowers your blood sugar, right? It takes glucose from the blood. It helps you get it into your cells so your body can use it for energy. Extremely important. But there's so much else under the surface that insulin does that most people have no idea. It's actually a master hormone. So when it's out of balance, it can affect heart health and cancer risks and fertility and inflammation. So at its surface is a hormone that helps us lower blood sugar. And below the surface, it's a hormone that affects every other cell and hormone in the body.
All right, we're going to get below the surface today.
Yes, perfect.
I'm excited. Let's start with a little bit of insulin resistance 101. What is insulin resistance and essentially what's happening in the body when someone has that?
So insulin resistance simply is when the body's cells aren't responding to insulin anymore. So what causes that is certain foods cause oversecretion of the insulin from the pancreas. The pancreas really just has to work harder to get the glucose into your cells. Well, your cells have these insulin receptors. And I did this really great piece one time on Instagram where I got an apple with some golf tees. And I said, this is your cell. This apple is your cell. And these golf tees are your insulin receptors. And insulin binds to the receptor and it lets glucose in. But when you're insulin resistant, because you've been eating and you have these lifestyle habits that force that pancreas to just work harder and harder and harder, those cells get a little bit overwhelmed with how much insulin they're being bombarded with. And so they say, hey, I'm overwhelmed here. So they start taking those receptors off. And that is the process of insulin resistance, is when the cells say, nope, I've had enough. They take off the receptors. Well, without the receptors, the insulin can't do its job, right? And then at that point is really when the snowball begins, because then the pancreas says, hey, there's all this glucose in the blood. It can't stay here. We're going to send out more insulin. And then the cells keep responding by taking more receptors off. So this is truly the snowball.
So it's like those golf tees or insulin receptors are falling off the apple or cell, but the cell is still getting more insulin than it can handle. Now, are you describing insulin resistance as a spectrum, or is this you have it or you don't?
Oh, absolutely a spectrum. If you're a baby and you're just born and you're supposed to be perfectly healthy, right? You're a 0 on this scale. And a 10 would be somebody with diabetes. And everybody exists somewhere on that scale between 1 and 9. And where you are on that scale is how high your insulin levels are, right? It's directly related to how insulin resistant you are.
Let's talk about some of the risk factors. Who is usually affected by insulin resistance?
So anyone and everyone can have insulin resistance. Many people do, because you could have insulin resistance for years or decades before your glucose levels ever actually become abnormal. But some of the risk factors would be Hispanic or African American descent. Those populations are genetically predisposed to over-secreting insulin. Others are polycystic ovary syndrome, or now polyendocrine metabolic ovarian syndrome. They're not born at a 0 on that 0 to 10 scale. They might be born at a 3, right? They're just a little bit ahead of the curve on their way to diabetes, which is why we see diabetes prevalent in this population. Other ones is pregnancy. Pregnancy is a natural state of insulin resistance. The body wants to become insulin resistant because that's how it stores fat. It stores fat so the body can use it after delivery. So it's a natural state. So it's not always a bad thing. It's just that it's bad when you're always insulin resistant, right? And then the last one is perimenopause. When you have a drop in estrogen, which is what you start to see in your 40s, it corresponds to a rise in insulin. And that rise in insulin is what's causing the belly fat and the sleep disturbances and cardiovascular disease issues. So those are some of the populations that really struggle with this the most, but really anyone can develop insulin resistance.
Let's talk a little bit about symptoms, maybe what's happening inside the body that someone might not feel, or if there are any external or physical signs of insulin resistance.
Obviously, PMOS is irregular cycles and all of that. And of course, weight gain, right? Insulin is a fat storage hormone. It's a storage hormone across the board. So it obviously makes it very easy to gain weight and very difficult to lose weight. So that's obviously one. But two others that I think people don't realize is that it makes you chronically fatigued and it makes you always hungry and hungry for sugar and starch. And there's a couple reasons. First is insulin, when it's high, it actually blocks your body's ability to burn body fat. This was a study we actually did to see if we could lower people's insulin, would it make them more able to burn body fat? But when your insulin is high, remember, insulin is a storage hormone where your body can't store fat and burn fat at the same time. That's one of the problems. The other is you have less receptors on your cell, meaning insulin is struggling to get enough glucose into your cell. All right, so here you are, a woman, your insulin is high, so you're struggling to get enough glucose into your cells and you're struggling to burn your body fat. And your body says, I am starving. I cannot get the energy I need right now. You need to keep eating. And also, I don't want to burn muscle mass for energy, so I need you to take a nap. So they're always tired because their body has a fuel access issue. And they're always hungry because their body, it only has one other option: make them eat and take a nap. And so that is two of the biggest symptoms, is chronic fatigue and constant hunger.
I feel like I want to raise my hand right now, like, uh-oh, is it my kids I'm blaming this on? Or is this my insulin?
It could be both.
Can you talk to me more about the connection between now PMOS and insulin resistance?
I've been managing it for 25 years. Before I got diagnosed, I was in my fourth year of undergrad for nutrition. I was working to become a dietitian. I was 50 pounds heavier. I was doing all the things. I was vegetarian and I was eating oats and quinoa and sweet potatoes and all the things. I mean, I ran every day. Like, I just couldn't get the weight off. I didn't know I had PCOS. I didn't know I had this condition that made me glucose intolerant. And all of those nutritious starches weren't very health promoting for me and my metabolism. With PCOS, there's this genetic change in the cells in the ovaries that I call it like a traffic light. Think about when you're getting onto the interstate or the highway and there's like a little light that's like slow. We don't want too many people getting on at one time, right? That is what most women without PCOS, that is how their ovary responds to insulin in terms of making testosterone. It's like, okay, like we need some, but like we don't want to overwhelm our system because having too much testosterone is bad. With PCOS, that light is always green. Pedal to the metal. We can just crank this out all day. Like, I also think about the I Love Lucy episode from like when they're in the
she's eating chocolate.
Factory. Yes. It's like, yep. It's just coming in and coming in. The body's like trying to deal with it, but it's just like, it can't. That's what's happening when your insulin is too high. But also when you have too much insulin and too much testosterone, it causes all these symptoms, right? It makes you less likely to ovulate, which is why they have irregular cycles and they often struggle to get pregnant. It causes the sebaceous glands to become overactive, which leads to oily skin and clogged pores. And same thing with the scalp hair loss. So it causes all these symptoms when your insulin is high and your testosterone is high.
Can we talk about some of the maybe external signs or physical symptoms that people might see or prompt them to schedule an appointment with a health professional?
Absolutely. In so many patients, it actually shows up on your skin in a variety of ways. Of course, with PMOS, that's hirsutism or facial hair growth or acne, but the other is what's called skin tags. So what's really happening there is, again, insulin is your growth hormone, and those cells are being told to grow and to replicate. And so that's what's showing up as these like overgrowth pieces of skin. These are skin tags. And then the other is what's called acanthosis nigricans. And so this is where this reddening of the skin, or it's not really reddening, it's darkening and it's thickening. And it's the same exact concept. These skin cells are being told to grow and they're replicating, they're too fast. And so you're getting that thickening on skin. So those are two that definitely stand out.
What about conditions like sleep apnea, liver disease? Are these also related? And is this like a chicken egg thing or part of that iceberg we haven't seen?
Definitely related, especially the liver fat. If you remember, I said when insulin is high, it's difficult for your body to burn fat, right? And in your bloodstream, you have blood fat circulating around because they're waiting to be taken up by these cells to get burned. But if insulin is high, the body can't burn them for energy. Remember, you can't burn fat and store fat at the same time. So if your fat storage hormone is high, your body's like, well, we're obviously not burning fat right now. We're storing it. So those blood fats, they don't have anywhere to go. So where do you think they go? They get stored in the liver. And that's where you start to have fatty liver. It's not necessarily that you didn't take enough liver detox supplements.
Or drink your tea.
Or drink your liver detox tea. It is that your insulin is too high. And so that's definitely one of the bigger ones. And then sleep apnea, as far as chronic inflammation and just excess weight on the chest, all of that can be associated with sleep apnea. But liver disease is definitely one of those.
Is chronic stress a factor in developing insulin resistance?
Oh, yeah. So earlier when I said insulin is a master hormone, right? Cortisol has its own iceberg.
I was actually just going to say that.
Is that it's our stress hormone, but what cortisol really does is affect every other hormone. You have cortisol and you have insulin. They affect every other hormone and they affect each other, right? So yeah, absolutely. When cortisol is high and your stress is high, we know this as dietitians, right? Because what happens when somebody is under stress because they're in the hospital for some reason? We see their blood sugar spike. It's very common to see that when there's injury, anything like that. That's the body trying to release as much glucose into the bloodstream so that it can use that for energy. Well, what does all that glucose in the bloodstream do? It tells the pancreas, hey, there's glucose in the bloodstream. We need insulin. So it definitely all goes together for sure.
Are there any medications out there that cause insulin resistance?
Some of the long-standing diabetic medications, like sulfonylureas, force the pancreas to make insulin. And over time, the long-term side effects of sulfonylureas we know are worsened insulin resistance, pancreatitis, pancreatic cancer. That pancreatitis, that's one of the reasons why on GLP-1 labels is a black box warning for pancreatitis. If you're eating foods that make your pancreas work harder and you're taking a medication that makes your pancreas work harder, you're at risk for pancreatitis. So not everybody gets that. It's definitely on the labels, but it's just, I think, something that can be avoided with the right nutrition education.
What about long-term health risks of having insulin resistance? So I think people mostly think of diabetes, right? But let's talk more broadly.
Well, obviously cardiovascular disease. And that's because, cardiovascular disease is a combination between chronic inflammation, high cholesterol, high blood pressure, high triglycerides. All of those are directly related to elevated insulin. Triglycerides, those are those blood fats, right? And the blood. Insulin directly relates blood pressure because your blood pressure is actually regulated by a hormone called aldosterone. And remember, all these hormones communicate. And then the other is chronic inflammation, which elevated insulin is the driver of chronic inflammation. Actually, this is an amazing study. So 1966, they took a group of men. They measured a variety of different markers and they followed them over time. And they found that of all the markers they looked at, if their insulin was high, they had a higher risk of developing cardiovascular disease. So absolutely associated with that. The other one I want to highlight is cancer. I don't know if y'all saw this most recent 60 Minutes episode where they got a Harvard oncologist researcher, and he was talking about how these really common cancers today that we're seeing so much of, obviously breast cancer, prostate cancer, but colon cancer, pancreatic cancer. He said these tumor cells differ from other types of tumor cells because they have insulin receptors. And when insulin is high, which it is for so many people, it tells those cells to grow, right? Well, if you're taking chemo, which is trying to tell those cells to shrink, and your insulin is high and it's telling those cells to grow, the therapies aren't working the same way that they should be. And so I think cancer is a huge one. And mental health. Mental health is a huge one. Sleep issues. And then, of course, infertility is a major one.
Let's talk about testing. What tests indicate if you have this, right? Like we have oral glucose tolerance tests. We have blood draws. Like I'm panicking. What do I need to ask for?
Don't panic. Definitely a fasting insulin is the best marker. So when you go to your healthcare provider, they're typically measuring an A1C. That just tells you if your blood sugar is normal. That doesn't tell you how hard your poor little overworked pancreas is pumping out insulin to keep fat glucose normal. That number, that insulin number, that's what we want to know. How much is your pancreas working to keep blood sugar normal? So a fasting insulin. Another option would be for an oral glucose tolerance test, which is super annoying, but many of these workups are. And you'll go in and you'll drink a glucose drink and you'll wait an hour, maybe two, and you'll test your insulin again. And that tells us how much insulin your pancreas is having to secrete after eating a lot of glucose. Those are the two best options.
Are there markers that people might already know, let's say labs they've already had done in the past, that might predict that they're at risk?
Well, if your A1C is high and you're overweight, your insulin has been high for a long time, probably, but that doesn't mean you can't reverse it, obviously. If you have your triglycerides and your HDL, you can do what's called a triglyceride to HDL ratio. Sometimes this already comes back with your labs, but you can just divide your triglyceride into your HDL, and you want that to be below 2. That is a good marker. It's definitely not the same, but it could give you an early understanding of whether or not you might be a little bit more metabolically distressed.
Insulin resistance is a spectrum. Over time, the body's cells become overwhelmed and stop responding as well to glucose, which forces the pancreas to make even more insulin. It's a snowball effect that can eventually lead to diabetes. But before that, if you have higher insulin levels, you may notice things like stubborn weight gain, constant hunger, fatigue, skin tags, or dark patches of skin. And insulin resistance is connected to much more than just blood sugar. It plays a role in conditions like PMOS, formerly known as PCOS, heart disease, and even chronic inflammation. Stress can make things worse by increasing cortisol, which raises both blood sugar and insulin levels. Now let's explore which foods can improve insulin resistance or make it worse. So we're going to talk about more of the lifestyle intervention, the reversing insulin resistance. Is it possible to reverse it once and for all?
When you say once and for all,
we still got to do the work.
You got to do the work. You're going to have to do it. It's not like okay, I am good, and now I can go back. Just like anything,
Yes.
It takes consistency. It doesn't take perfection, but it does take consistency and being more mindful about the things that you're eating. I mean, I've had to learn this myself. So I call this approach a low insulin lifestyle. It's pretty straightforward. I just help patients understand what foods cause the biggest insulin spike and what foods don't. And in our studies, that's all they did, right? We gave them a sheet of paper and it had all these foods they could eat as much as they want, whenever they want. And then these few foods that were like, don't eat these for 8 weeks. And they didn't exercise. They weren't allowed to exercise, right? This is a lifestyle intervention, a diet intervention. We wanted to know, what does this diet do specifically?
Interesting.
Not what exercise does, because then it's difficult to know which one actually led to the benefits. And they didn't count calories, carbs, literally just eat whenever you want these foods. And these patients came back and they lost, on average, across the studies, about 19 pounds. And they dropped their insulin by 52%. They were PCOS patients, so they even had a drop in their testosterone by 23%, no medication. So it's truly just this lifestyle approach of avoiding or limiting foods that spike insulin, right? It's pretty straightforward, pretty simple for that.
How different is this than what people think of when they think about a diabetic diet?
So diabetic diet, you're still counting carbs because if you're on insulin, you need to be mindful that you're not getting a low blood sugar. And it's not the same as a low carb diet because patients don't have to count carbs on this. They can eat all the carbs they want, but it needs to come from non-starchy vegetables and fruit
Okay.
or nuts. And
We get to do fruit. You know that people are panicked about fruit, Allie.
they're panicked about fruit, but like okay with eating potatoes. Like I just don't understand.
Chips specifically.
Yeah, exactly. So no, they ate as much fruit as they wanted and their A1C, no, the patients couldn't be diabetic to be in this
Sure.
study.
That makes
So
sense.
their A1Cs were all normal, their insulins were all through the roof, which is so common.
Wow.
Wait, so
Yeah.
common. And their A1C to start was 5.5.
Okay.
And after 2 months, their insulin or their A1C dropped to 5.3. Now, I want to say how
That's a
difficult,
big difference,
it's not as
guys.
hard. It is not too hard to go from an A1C of 10 to 9.8, right? It's some
Yeah.
small modifications. But to go from a 5.5 to a 5.3 in 2
When you're
months,
already normal. Yes.
when you're already normal, it's 2 months, which means A1C is a 3-month marker, which means it's changed quickly. That's amazing, right? So, and it's just a different way of thinking about food.
Can we talk about some of the foods that are triggering? So the foods that we want to limit.
Yes. Well, we'll start first with certain carbs. So when I think of things like starches, right? Starch is pure glucose. They differ from other types of carbohydrates like fruits in the fact that they're pure glucose, and glucose is a major stimulator of insulin. So when I tell people, sure, quinoa is full of fiber and plant-based protein, and beans are as well, and sweet potatoes are full of beta carotene, that is great. And those are very nutritious foods. They're full of nutrients, but they're also full of glucose. And if you're somebody who's insulin resistant, the last thing you want to eat if you're glucose intolerant is a bunch of concentrated glucose. I would say for these patients in our studies and in a low insulin lifestyle, treat starches as a treat, not something you have to build every meal around. The other thing that surprises everyone, the most insulin spiking food you can eat. I want you to guess it.
Oh no, I'm scared.
Whey protein powder.
I've seen this on your social media before.
Yes.
And I was like, wait, why doesn't Allie like it? So tell me more.
Okay. So whey protein is extremely concentrated in branched chain amino acids, and specifically leucine, because the purpose of whey in nature is to help stimulate growth in a newborn baby and to help them gain fat, right? Because whey comes from milk. And the biological purpose of milk is to stimulate insulin, which is the next thing, which is milk. It's not been fermented. Milk actually has insulin in the milk because a baby's pancreas is not fully mature at birth. And so it helps them by getting the insulin from their mother's milk to help stimulate and increase insulin levels so that they can grow. Remember, insulin's a growth hormone. Well, you don't grow any faster in your lifetime than you do the first year. Think about how fast a baby grows. They're not growing that fast because they're eating so many calories, right? For the 2 ounces of milk that they're getting. They're growing so fast because they're getting insulin from the milk. And if a mom has high insulin, then her milk has even higher insulin. So that's why you often see babies from more overweight moms become more overweight. So that's milk is one of those. Not all dairy, but milk. We'll talk about dairy in a second, the ones that we do allow.
Okay.
But as a part of milk, you have proteins. You have whey and you have casein.
Yes.
Right. In a cup of milk, you only have 2 grams of whey protein because whey protein is super growth promoting. But today, we're putting a scoop of 25 grams of whey protein. It's in everything. It is in everything. And so imagine how much insulin so there was a study they showed that whey protein spiked insulin more than a slice of white bread.
Okay, white bread was actually going to be my answer.
Yeah. White bread's the control for most things. Whey protein almost double the insulin spike of white bread. And so those are the 3 things is unfermented dairy. So things like milk, whey protein, and starches. But dairy as a whole, and I don't recommend anybody be dairy free. They don't have to be unless they want to. But when you ferment dairy, like Greek yogurt and cheese, it does help with that insulin response. So we do allow some dairy.
I love it. Tell me about what's on the we can eat this list, because I heard you say we're not doing low carb necessarily. I heard you say something like yogurt. I heard you say fruit. So low insulin is not necessarily low carb.
Right.
What do we get to eat?
non-starchy proteins, whether that's coming from meat, fish, poultry, eggs. And I also love lupini beans, which most people don't know what those are, but they are one of the only types of beans that are no starch. They are just pure protein, pure fiber, and they're so yummy. And they actually there's all these brands that are making lupini bean noodles because remember, chickpea noodles, while better than regular noodles, are still a lot of starch because chickpeas are starchy. So lupini beans are one of my favorite plant-based proteins, but also edamame, tofu for vegetarians. All of those are great protein options. And if you love protein powder, that's fine too. The protein powders I recommend are things like egg white protein. It's just powdered egg whites. I even think collagen and bone broth. I know the whole idea is like, well, they're not a complete protein, but you and I know as dietitians, as long as you're eating protein sources throughout the day, you're getting all you need. And then if you're plant-based, you can have like hemp seed protein. Those are all good options. All the non-starchy vegetables and fruits you want. Like I told patients, I want you to try to eat a pound of vegetables every day. Just go get one of those 1 pound bags of like mixed vegetables from Walmart or whatever and like that, make that a goal. And fats, avocados, olive oil, avocado oil, coconut oil, nuts and seeds. That's what's going to keep you so full and makes you better for your skin and your hair. So proteins, vegetables, fruits, nuts and seeds, healthy oils. I'm not going to say it's a health food, but I do have on there a glass of red wine, like 6 ounces or less sometimes, and extra dark chocolate. And then your fermented dairy as well. So that's kind of what a low insulin lifestyle is.
Do we worry in this low insulin lifestyle about our meal timing or frequency? Is that part of the equation? Do we do intermittent fasting? Like, tell me more about meal snack structure.
I truly think that just being simple.
Love it.
If you don't like to eat breakfast, don't eat breakfast. But don't set your watch that you're like, I hate till this time,
Amen.
right? I live by one simple rule. If it spikes my insulin, I try to eat it as least often as possible. And that's it. That's my one rule, right? And I move purposefully. I don't stress about calorie burn. Before this call, I was eating peanut butter straight from the jar. Like I don't have time to sit down and think, where are my 35 grams of protein going to come from?
I don't want to live in my phone. I don't want to do math all day long.
That's why in our app, we have recipes, we have grocery lists, but we don't have a meal planner because I want people to stop thinking about every little thing and focus on the one thing that's really going to make them better and healthier and help them improve their goals is to lower insulin. And fasting, sure, maybe it works, but not if your eating window, you're eating all the things, right? And so it's just focused on the one thing and everything else, just adapt it to your lifestyle and what makes more sense for you. And everything is going to, it will fall into place.
In the same vein, can we talk about sweets?
Sure.
The ice cream truck might roll around. My kids freak out. Do I get to enjoy it with them? If it is infrequent for me to do that.
I do, but I also make sure that if I'm going to eat ice cream, I want it to be real ice cream. I want there to be 4 ingredients in it. Cream,
yes,
eggs, egg yolks, and sugar, right? I love the Ninja Creamy. I make my own almond milk stuff. I make these things called banana brownies, which are totally viral and they're amazing. And we keep them in my house all the time. I eat dark chocolate, but if I'm going to eat ice cream, make sure it's premium. When you go to the grocery store and the things that you think are oh, this is a brand that's really premium. No, it's monoglycerides, diglycerides, skim milk. So if you're going to cheat, make sure it's premium.
We have said this before, and there's a physician I work very closely with who says there is a category of foods that it is absolutely worth it to eat in small amounts with a really high quality. And that's all you'll need. Cheese.
Yes.
Wine.
Yes.
Chocolate.
Oh, yeah.
Ice cream.
I absolutely agree.
The real stuff. I hear that you're not telling people to necessarily count carbs or count calories. Are you doing anything with their macronutrient distribution? Are you doing a balance of carbs versus fat versus protein?
When we did food logs for our study, we wanted to know, what are they eating? If they could just eat whatever they want, what are they eating? They were eating roughly just under 1,500 calories a day. They were eating about 90 or so grams of protein. They were eating about 100 carbs and about 25 to 30 grams of fiber. So that's just what they were eating naturally. I tend to like the idea of not worrying about food so much. it's really about focus on all the other things that bring you joy in your life
Yeah.
and not about the intricacies of every morsel of food you eat and every macronutrient, because truly, I think you're going to naturally fall where you need to. When we talked to you before, we're about what are the most common symptoms of insulin resistance. It's increased appetite. That's the first thing people say to me is after they start this, they're like, I used to dream and think about what I was going to eat next all day long. And now I have to remind myself to eat because your brain says, well, I've got all this stored body fat to use for energy now. I don't need to keep her hungry all the time. I mean, it truly is a switch. It is a switch that changes and you're like, I don't even need that stuff. It's pretty amazing.
Instead of counting calories, carbs, or obsessing over when to eat, try a low insulin diet. That means filling up on protein, non-starchy vegetables, fruit, healthy fats, nuts and seeds, and fermented dairy like Greek yogurt. Starchy foods like potatoes, rice, and even nutrient-dense options like quinoa and sweet potatoes may trigger insulin production. But if you're going to indulge, go for the high-quality products. How about the other aspects of our lifestyle? What else can be done to lower insulin levels?
There's a lot of talk of insulin online with people encouraging others to move after eating, right? We know that movement helps bring down blood sugar. Go on a 15-minute walk after your lunch or after your evening meal. Generally speaking, I believe that's good advice. Is it effective for also lowering insulin?
Yes, absolutely. So when you're exercising, during exercise, it's really amazing because those cells can actually pull glucose from the blood without insulin. Well, that's amazing because now the pancreas is like, oh, I can take a little break. I don't have to make as much insulin because the glucose is just getting pulled into the cells. That's what's so amazing is that just a little walk, it gets those muscle cells. It allows to pull that glucose from the blood, which means there's less insulin that needs to be made. And that means it lowers insulin.
When you educate people, do you talk to them about label reading at all, right? So again, tip of the iceberg, blood sugar, diabetes. We talk about looking at total carbohydrates. Maybe we look at added sugar or fiber. Do you have grocery shopping tips or label reading tips about ingredients even for people who want to be sensitive to their insulin changes?
Yes. So I would say oftentimes you don't even need to read the label itself. You only need to read the ingredient list because if the ingredient list is what I want to say clean is not necessarily always what everybody else considers clean, then you don't need to worry about the rest.
Mm-hmm.
Now, there's obviously exceptions, but I tend to work by a rule of 5. If starch, whey, or sugar is in the first 5 ingredients, then it's probably something that's going to be more insulin spiking. If they're not, you're probably good. Now, there's some different things like I love sriracha, right? I'm not just eating cups of sriracha, but yes, the second ingredient in sriracha is sugar.
But that is a condiment.
It's a condiment. Exactly. So those I don't worry about. But otherwise, if it's got flour, if it's got rice or quinoa or those types of things in the first 5 ingredients, you can be pretty sure that it's going to be more insulin impacting just because of that. So I think that's an easier one. And then obviously hydrogenated oils and all of that is a big one.
Do you have patients or people that you work with who wear a continuous glucose monitor or CGM, even if they don't have diabetes?
The concept of CGMs are great. If you have diabetes and you're taking insulin and you need to know what your blood sugar is all the time, sure. I went to this PCOS conference and they were giving this lifetime award to one of the physicians who's been studying this forever. And he shows the screen and he said, this is the study that I published that changed my career. He said, we took these patients with PCOS and we took normal ones and we gave them a CGM. And look what we found with their blood sugar. It was perfect. They gave them an oral glucose tolerance test and it just went up a little bit and went back down. Stayed these nice little hills. It wasn't like a huge spike. It was just these nice little hills, just like a normal, healthy, non-diabetic, non-PCOS patient. Just perfect little hill. Then the same patient, as they took their insulin, the normal one sent out some insulin, took the glucose in, cell was fine. That PCOS patient was so high, off the chart. And he was like, this changed my career because I realized we were doing this all wrong. We were doing this all backwards. We were testing the lagging indicator insulin had been high. And that is what I tell people. A CGM measures your glucose. It doesn't tell you how hard your body's working behind the scenes to keep that glucose level down. But when I launched my company to help educate these patients to lower insulin, I kept running into this problem, is that they couldn't get their insulin tested because their provider was like, no, we're not testing that. Or, for whatever reason, they just couldn't get it tested. So I had this wild idea that I was going to launch an at-home insulin monitor. And so we are currently in the process. We've submitted patent, which submitted to the FDA.
Wow.
So that people can test this at home anytime they want. They can test after foods and find out
Did a finger prick?
Yep, with a little finger prick, and they can find out their Starbucks Frappuccino spiked their insulin to 300, and it'll help them walk through, like, maybe this is how you should order it next time. Let's test again. So to really give people something that they can work on at home, real-time information about their metabolic health. So we're really excited about it.
Congratulations. We can't talk about insulin resistance without talking about GLP-1s. What's your take on them?
GLP-1s can be helpful, but it's so important that these patients understand how these medications work, because I don't think this is being talked about enough. GLP-1s were originally designed to help people that didn't make enough insulin make more, right? It tells the pancreas to make more insulin. That's what helps them lower their blood sugar. That's why it's good for diabetes. That's great. If you are somebody who already makes too much insulin, you don't really need to tell the pancreas to make more. It's already cranking out that insulin. But GLP-1s do another thing. They blunt your appetite. So there is a little bit of where your patients are eating less, so they see their insulin come down, and that's great. Now let's give you a scenario that I see a lot and I think is a big problem. You go on a medication that tells you to eat less. So now you're in a calorie deficit. But the foods that you're choosing are spiking your insulin, and you're on a medication that spikes it even more. Now, what do we talk about? Burning fat when insulin is high. It's very difficult, but your body has to make up that calorie deficit, right? Well, where do you think it's pulling that energy from?
Well, and that's why we're so concerned about lean mass. Yep.
It's pulling that from muscle mass because it doesn't have any other option. You can't not make up that calorie deficit.
Yeah.
But you're on a drug that's forcing the pancreas to work harder, and you're eating foods that are forcing the pancreas to work harder, and it doesn't have any other option but to get that energy from lean mass. So if your patients are going on a GLP-1, the best thing they can do is really make sure that the foods they're eating give their pancreas a break so that they can burn more body fat.
What do you tell people when they ask you about supplements?
That I don't take any.
Love it. Me either.
So what I tell them is it's not going to hurt you, but you shouldn't expect to take a supplement if you're not changing your lifestyle. And if you change your lifestyle, you don't need to supplement. And if you choose to take them, definitely don't buy the expensive ones because you're just paying for the branding and the marketing. It's like inositol. I think that's the biggest one people ask me about. Is there data that it can be helpful? It's conflicting, but it's not going to hurt you. It might help you. You could try it, but there are brands that are extremely expensive because they spend a lot on marketing and pass that cost off to the consumer. But then there's others that are extremely inexpensive and they're going to do the same thing. So if you want to do it and you want to try it, that's great. It is not a magic supplement or magic pill that now says, okay, well, I can eat whatever I want because I'm taking this.
Any other kind of final lifestyle tips or advice for listeners, especially for people who might be a healthy weight, they exercise reasonably, they're watching their diet? What are kind of your big takeaways?
I love the idea of purposeful movement more than I like the idea of just straight exercise. I might not be somebody who's constantly lifting dumbbells at the gym, but I think nothing about picking up a 25-pound bag of soil to work in my garden, right? So I think purposeful movement, I think thoughtful choices if you are insulin resistant, understanding your metabolism. Somebody with a nut allergy just has to accept the hand they were dealt. And I don't like to say that because I understand people don't want to hear that, but they have to do that. And if you are somebody that's predisposed to insulin resistance, just being more mindful of this is my situation. And if I want to be healthy and I want to achieve the goals that I have set for myself, I might have to make some changes to the things that I previously considered to be healthy. And I think just taking a step back and not spending so much brain power on all the little things, what supplements and how many supplements am I taking and how many meals am I eating and how many snacks am I eating and what time am I eating and I should stop eating before this time, because then if I'm going to store it all as fat. And did I exercise enough and did I do enough weight training and did I take enough creatine and did I have enough protein? It's just too much.
And you're stressing me out. And I thought we talked about earlier that stress is a component of this.
Exactly. It's so much when really all of it is just, and I hate to even say that because I know it sounds crazy and so cliche. It's really one or two things. It's stress and your diet. It's stress and overconsumptions of foods that don't promote health in your body. And if you can fix those two things, you're going to sleep better. You're not going to be as hungry all the time. You're going to have more energy to want to move purposefully. It's those two things that I think is really where you need to focus your energy on. And other than that, find hobbies, spend time with your family and your children and everything else.
Yeah, snowballing, but in the right direction.
Exactly. Exactly.
Dr. Chappell, thank you for sharing your knowledge and your wisdom today.
Thank you for having me. It was so fun.
Insulin resistance can be improved through consistent lifestyle habits. Even something as simple as a quick walk after a meal can help your cells use up glucose without needing as much insulin, which gives your pancreas a bit of a break. When you're grocery shopping, don't obsess over every number on the nutrition label. Just use the rule of 5. If starch, whey, hydrogenated oils, or sugar are listed in the first 5 ingredients, it's probably going to spike your insulin. GLP-1 medications and supplements can serve a purpose, but diet and lifestyle should come first. Just focus on the basics. Eat in a way that supports healthy insulin levels, find ways to move your body that you actually enjoy, manage stress, and don't let nutrition take over your life. That's all for this episode, but if you have a follow-up question, leave us a voicemail at 507-538-6272, and we'll answer it in a future episode. For more On Nutrition episodes and resources, check us out online at mayoclinic.org/onnutrition. And if you found this show helpful, please subscribe and make sure to rate and review us on Apple Podcasts or your favorite podcast app. It really helps others find our show. Thanks for listening. And until next time, eat well and be well.